I knocked on the door. I provided privacy. I provided adequate lighting, and now I'm going to perform hand hygiene, and now I'm going to introduce myself. Good evening. My name is Destiny. I will be your nurse for today. Can you tell me your name and date of birth for me, please? Okay, thank you. Today I'm going to be performing a physical assessment on you. And if it's okay, will you please get up and go to the bathroom and change into this gown? While the patient is up, I will assess her gait, and which is steady and even. The patient is appropriately dressed and well groomed. She's smiling. She's talking with me. Okay, can you tell me what year it is? She stated that the year is 2020. Can you tell me what day it is? She stated that today is Monday. The patient is alert and oriented ×3, and she's showing no signs of distress. Okay, on the scale of 0 to 10, can you rate your pain for me with 0 being the least and 10 being the most? Patient stated that her pain is a 0. Okay, now I'm going to lift this bed up. To check your pupil reaction. And if you will, look at me, and I'm going to dim the light. Okay. Pupils are equal and reactive to light. Alright, now I'm going to palpate your pulses, starting with the left carotid artery. Now the right carotid artery. And both of them are strong. Now I'm going to palpate the brachial artery. Both are strong and equal bilaterally. Now I'm going to palpate the radial. And both are strong and equal bilaterally. Alright, now I'm going to test the capillary refill. And both are less than 3. Now I'm going to assess her skin. I see no redness, no bruises, or no lesions. Her skin is warm and dry, and there's no edema. Alright, now I'm going to listen to your lung sound. Okay. Starting with the right upper lung. Now the left upper lung. Now the right lower lung. And the left lower lung. Now I'm going to listen to the base of the left lung and the base of the right lung. And I hear no crackles, there's no wheezing, and her lung sounds are clear on the anterior side. Now I'm going to sit you up and listen to the posterior side of your lung. And while I'm back here, I see no erythema, no bruising. Now I'm going to listen to the right upper lung, the left upper lung, the right lower lung, and the left lower lung. Now I'm going to listen to the base of the left lung and the base of the right lung. Okay, now I'm going to lay you back down. Alright. Now I'm going to listen to your heart sounds. And on the posterior side of her lungs, they were clear, there was no wheezing or crackles. Now I'm going to listen to your heart sounds. Starting with on the right side, I'm going to listen to your aortic, which is in the second intercostal space. And on the left side, I'm going to listen to the pulmonic, which is in the second intercostal space, on the left side. Now I'm going to listen to the Erb's point, which is in the third intercostal space, on the left side. Now I'm going to listen to the tricuspid, which is in the fourth intercostal space, on the left side. Now I'm going to listen to the mitral, which is in the fifth intercostal space. And for 1 minute, I will listen to the apical pulse. and her heart sounds are even. Okay. Now I'm going to assess her abdomen, and I see no masses, no pulsation, no bulging. Now I'm going to listen to her bowel sounds times 4 quadrants, starting with the right upper quadrant, now the left upper quadrant. I'm going to listen to the right lower quadrant and the left lower quadrant. And now I'm going to palpate the abdomen. Let me know if you feel any pain. Okay. Patient's abdomen is soft and non-distended. Her bowel sounds are normal active. Alright. Now I'm going to assess your lower extremities. Okay. Now I'm going to assess the skin. It's warm and dry. There's no edema. Now I'm going to palpate the popliteal pulse. Both are strong and equal bilaterally. Now I'm going to palpate the posterior tibial pulse. Both are strong and equal bilaterally. Now I'm going to palpate the dorsalis pedis pulse. Both are strong and equal bilaterally. Okay. Now I'm going to test her strength. Alright, push against my hand. Okay, push up. Okay. Now I'm going to perform range of motion. I want you to bend your knee. Now up. Left side, bend. Up. Okay. In the lower extremities, her range of motion is normal and equal, and her strength is good. Now I'm going to do range of motion on her upper extremities. I'm going to go up with the right, back down. Up with the left, back down. Okay. Now I'm going to test the strength in your hand. I want you to squeeze for me, please. Alright, thank you. In her upper extremities, her range of motion is good and normal, and it's strong. Now I'm going to test your sensory, with this side being sharp and this side being dull. And let me know what you feel. Sharp, dull, dull, sharp. Patient's sensory is intact. She stated that she felt it. Now I'm done with my assessment, and I'm going to cover the patient back up, let the rail back up, lower the bed, and I'm going to place the cowbell within reach of the patient. Alright, now I'm done with your assessment.